The program is a 6-week community-based day treatment program for people experiencing drug and alcohol issues who may also have mental illness. And we started in 2016 with systems reform funding through Partners in Recovery, and we've been going now over that period of time through lots of funding from Metro North Hospital and Health Service Link project funding, and now we have secured 2 years and 3 months funding through Queensland Health to run a longer pilot with a 1-year evaluation. I think it's had a significant impact in that we aim to fill a particular gap in the system, which was the space between low intensity counselling and community-based support groups and intensive residential treatment. So sitting in the middle of essentially a step up, step down care system. We've been able to provide that significant support and make a lot of changes in people's lives. We've been very positive with the outcomes we've gotten, with nearly 50% of people who participate in the program have graduated, and we've also had an engagement rate, and by that we mean people who stayed in the program for the entire time but maybe not graduated, they haven't done quite enough of the program. That's sitting at around 2/3 of participants, and we've seen that very consistently through each program. The model itself came from a few different ideas. We obviously looked at a few different day programs around. We visited programs down in Melbourne, a few different day programs there. We got a lot of support from Regen, who run the Catalyst program and the Talk day programs down there, and they've been really supportive. We generally created our model separately to them, but when we went and looked at theirs, we realised how similar they were. Previously I've worked in residential treatment, so one big thing I wanted to do was hit some of those key points in the learnings that come from residential treatment around relapse prevention, around tolerance to sitting with difficult thoughts and feelings and cravings, and obviously putting in a big focus on routine. A typical day in Springboard is we start at 9 o'clock, so people will come in, they'll settle in to make a cup of tea or some breakfast, and then we'll sit down and we'll do a check-in with how people are going. We'll usually do some mindfulness exercises in the morning, and then we'll engage in one of the group sessions of the morning, which might be around acceptance and commitment therapy skills, or it might be relapse prevention. Then we'll have a short break and then head up to the gym. So we go to the PCYC gym at Lang Park and we do a workout up there with a great personal trainer. People get to do their own exercise up there, so we don't tell them what they have to do. It's very much about what they want to get out of going to the gym. And then we come back and have lunch, and then after lunch we'll do another session, which is usually going to be around psychosocial development. So it might be different concepts around sleep hygiene, might be assertive communication or boundaries, it might be about relationships and how people's communicate in relationships, or how they identify their goals and set goals for themselves that are important and meaningful. Yes, so initially I was working in another mental health program, and we recognised supporting community members who were looking for AOD treatment. They were finding it difficult to get into residential treatment, so we recognised that gap in service, and we approached Partners in Recovery with our idea, and also approached Lives Live Well, so a drug and alcohol service, to support us in writing the program, and then applied together with support from PIR to apply for further funding through Link. And we've received great support through Partners in Recovery and Primary Health Network, not only through that support in helping us to source the funding and in some assistance in creating the program, but then also we've gotten great guidance through our advisory group, with one of the program development officers from PHN sitting with us on our advisory group. Yes, so I think some of the great outcomes that we've helped to achieve are in the partnership with the other services, particularly with HADS, creating a real clear referral pathway from people who are entering detox into timely treatment that's available to them in the community afterwards. Certainly we've gotten great outcomes with our participants. We've seen many people return to study and work. We've had many people come back and visit us months and even now over years later to tell us about how they're going and to stay in contact. So that's been really fantastic to see. We also managed to do 2 youth pilots last year, and we actually got really good outcomes for some young people, and the level of engagement was much higher than we thought it would be. I think some of the big learnings we've had are firstly around, we can't give everybody every part of, every learning that we want in the first week. So just over time, looking at how we structure the program, what concepts and what skills to introduce at different times, and that's been through trial and error over time to really understand, knowing that people tend to drop out of programs in the first 1 to 2 weeks. So it's really important to get that first week in particular really right as far as what we're delivering, make sure people have something they can take home. The other big learning for us is about how we follow up with people afterwards. We were limited by funding in how we could follow up with people, and knowing that some people have a good plan, but 1 or 2 things can go wrong and they can start to fall off track. Under our current funding though, we did apply to put on another worker and we have succeeded in that, so now we can provide 12 weeks follow-up of individual support. So we're really hoping that's that missing piece in helping people stay on track. What could also happen in this area that would be really helpful would be some longer term funding. Certainly 2 years we're very grateful for it, but certainly some longer term stability allows us to plan further into the future, and obviously job security for staff. But I think one thing that would be really beneficial would be with a few other day programs which are starting up over the next 12 months to potentially look at a community of practice between those different services to see how they might be able to share learnings. It's a field certainly in southeast Queensland where there haven't been a lot of day programs, so I think there's a lot of experience and learning that's going to come over the next couple of years, and it'd be a shame if that was siloed off into different areas and that we could get together and really help to improve and have a really high level, a high standard level for people entering into day program treatment, that they knew that they were going to get a certain quality.